Hi, welcome to the sections of cardiology. This is Dr. Jaitly. In this video presentation, I'm going to be talking to you about the commonly asked question, what is heart failure? Well, heart failure is a condition where the heart fails to meet the needs or the demands of the body. The commonest causes are when, say, somebody has long-standing high blood pressure and the heart tends to enlarge in that setting, is unable to meet the needs of high blood pressure, and therefore it's called heart failure. Now let's understand how the heart compensates in real life. Say we have normal hearts, I believe, okay? So now if I was to walk a block or walk a few blocks or play golf or play tennis, or say you're going up the stairs, you're rushing for a train or a plane, etc. So your heart tends to speed up, correct? It goes, say your normal pulse is about 60 to 70 at rest, and now it goes up to 100, 120, 130, even 150. And depending upon how well adapted you are, or during exercise, say you go to the gym and you're able to exercise, your heart rate increases. So the heart compensates. So when the heart decompensates, it's called heart failure. That means the heart is not able to meet the needs. Even despite increasing the heart rate, it's not able to squeeze enough blood per beat through this left ventricle. So one, either it's not able to keep up with the heart rate increase, or two, it's not able to keep up with the squeeze through the left ventricle. That's what is resulting into the weakness of the left ventricle or the weakness of the heart muscle, and therefore it's called heart failure. So the commonest cause, as I said, is hypertension. Then you have valvular problems where the valves are incompetent. That means the blood is now regurgitating back into the previous chambers. Remember, the blood can only move in one direction, from top chambers to bottom chambers in this flow. And these valves prevent the blood from going backwards. So when the blood starts going backwards, that also results into heart failure, because it's a very inefficient way the pump works then. Because the pump has to work efficiently in order to function throughout the day, the valves have to close properly and at the right time. And the timing is not correct, or they're not closing at the proper time or opening at the proper time, you have a problem, and that results into heart failure also. Poisons that you tend to pour through your mouth, alcohol, drugs, etc. So what will happen is the heart will initially try to compensate by increasing the heart rate in that individual, but later on it'll say, no, thank you, I can't deal with these poisons anymore, and then starts enlarging, unfortunately. And things can become very irreversible at that point, and then you end up only looking for a heart transplant, which is a very, very sad story, unfortunately. Anyway, sometimes it may be the viruses, and there are a couple of viruses which have a predilection or a tendency to go to the heart, and sometimes the cause is not even known or not found, even by extensive checkups by the heart doctor. So that's called unknown variety of heart failure. Symptoms are commonly seen as shortness of breath, where the person is not able to walk the distance which he or she was able to do so in the past. That means cannot run for a train, cannot go up the stairs, cannot walk the golf grounds, or not able to complete the tennis game, or even find fatigue moving from within the house, going from room to room. Cannot go up an incline, etc., etc. So that's shortness of breath on exertion. Swelling of the ankles and arms and face is the next thing that happens, and when that happens, things get a little more concerning, obviously. And then chest pain, palpitations, and dizziness. Dizziness specifically on bending forwards, and many times it can occur at different positions. Like the person wakes up in the night to go to the bathroom, suddenly feels very dizzy or is short of breath as well, and accompanied by chest pain. That could be a marker of heart failure. So these are the nutshell symptoms and signs. And now we understood what heart failure means. That means it's the failure to meet the needs and demands. And some of the causes are listed here, like I said earlier before. And we'll continue discussion on heart failure in the next several presentations as well. Look forward to seeing you again. Thank you for your interest, and I hope you enjoyed this part as well. Bye now.